All right. We're going to let everybody filter in. Tonight we're going to talk about a little bit of my fat transfers, and I can speak more about fat transfers. We're going to give a 10-minute discussion, have a talk prepared, and hope everybody enjoys that. And then we'll head into drrobcircle.com for a live Q&A, Ask Me Anything. After that, we have to celebrate my patient, Kathy, today. Oh, yes, Kathy had her 1-year anniversary today. So, shout out to Kathy if she's on. I told her to hop on. I don't know if she was able to. All right. We are live on Instagram, YouTube, TikTok, Facebook, and I'm waiting for my Substack feed. I don't know if it's going to work. And our subreddit thread is not running. So that's what we have going right now. Everybody filter in. We're going to get started. It's already 7. And I have Brandy, Danielle, and Elizabeth in the circle. And I have a number of folks on Instagram and Facebook. And I'm trying to get all the cameras lined up. Sorry. There we go. So the structure of this is going to be a 10-minute talk. And I instructed everybody on Instagram, Facebook, TikTok, YouTube, Substack, and our Reddit threads to go to drrobcircle.com because we'll have a live Q&A till 8 p.m. Central. So we're going to put a full hour in tonight. But I will not take questions during the talk on the other platforms. And then we'll go basically in the private platform to discuss anything and everything. We're doing that because I've been limited in what I can say on other platforms. So we're going to give it a few more minutes and then we'll get rolling. Hi, everybody. Got a lot of people joining on TikTok and Instagram. Just a few on YouTube. And usually I see Jen on Facebook, but I don't see her. This is going out to my private Facebook group as well, Explant Surgery and Breast Implant Illness. And, yep, people are filtering in. Good. All right, everybody hear me okay? Give me a thumbs up, a wave. In the chat, just hit me up. Let me know that you can hear everything. Oh, awesome, Elizabeth. I'm glad. That's great to hear. Welcome, Dara. Yeah, feel free to share the invites. Obviously, it's free to join at this moment. And we, for members, go live every Tuesday night for Taco Tuesday. And then on Thursdays, I present a 10-minute talk, and then we go live for everyone in the community. Hi, Dara. You're welcome. All right. So let's go. Everybody, we're going to talk about a little bit my fat transfers and fat transfers in general. I think there's too much confusion about that. So if you've been told you're too thin for fat transfer, or that fat transfer of the chest does not work, I certainly want to challenge that tonight, because I believe with the right preparation, fat transfer is one of the most powerful tools in reconstructive surgery. And I've been using it since 2004. Most people don't even understand that it's been possible since 2004, and it was used before that as well. So fat is living tissue. When we take it from one place to another, it needs to be with the right tissues. It needs a vascular environment to survive. If you put it in the face, it needs a very small amount to live, because the face has a rich blood supply, a rich lymphatic drainage supply. So there's usually excellent survival in the face. In the buttock is a very large space, very vascularized to the gluteus maximus. It's a really ideal area to put high volumes, and that's very reproducible. Everybody's heard of the Brazilian butt lift. But in the chest, for whatever reason, this becomes harder to understand, and there's a lot of issues with it. So think of it this way: the pec major is there, and the chest skin is there, and the fatty layer is there. Now, if those things didn't exist and we just fat transferred it, we'd have the same expectation probably as we would a buttock, if in fact the chest skin was less tight. But because the breast is there, there's a little bit more to navigate. So we don't put it in the breast, and we don't put it in the breast pocket if I'm taking out an old device. And this is probably why outcomes vary a great deal. So we talked about small volumes work in the face. For me personally, about a minimum of 500 cc's for a real visual change for a buttocks. And the chest is very different. It's more about preparation, optimization. Has the patient breastfed? Has their skin stretched from that, or devices, or the combination? Having a low BMI doesn't automatically disqualify you. And we'll go into specifics about why I do and prepare patients the way I do. What matters is what I feel like we do before surgery. So instead of reacting, I'm always wanting to prepare patients and optimize patients, because if we can do that, then we definitely can have better outcomes. So inside this circle tonight, I'm going to tell you exactly how I prepare my low BMI patients, and why most persons would benefit from this, and a lot of surgeons aren't really, I would say, in tune with that. Trying to be careful here, or not get us banned tonight. I believe fat transfer done correctly is extremely safe. I wrote a safety paper about it. So there's no foreign material. It's your own genetic material, which I think is the best possible methodology to use if you can. And the risks, I feel like they're very, very low. We can talk about them. You can be in the wrong space. You can put in the wrong volumes. And obviously, to me, what I'm telling you is the patient selection is the most important thing. So I run the Sharp method. I wrote a book about it. If you haven't read it or listened to it, it's really simple. It's a quick read or easy listen, if you want to think of it like that. And it describes my methodology for patient preparation, basically. I think that's not talked about enough. And in the circle, we're going to go into detail about why I think it's so important to do that. Now, I could talk about this, for hours, but I'm going to cut the discussion off, and we're going to go into the circle where I'll be specific about really how I try to run my protocol for patients, and then specifically low BMI patients, what I think about where to get fat from, what I do differently in the chest versus the buttocks versus the face, And that's not going to happen out here on YouTube or Instagram or Facebook or TikTok. And I don't think Substack ever got rolling, so it's not on. So fat transfer done right is one of the most natural, safe, and I feel like beautifully aesthetic outcomes that we can have in cosmetic surgery. The reason more people don't get it and don't get the results is I feel like a lack of preparation, maybe a little bit problem with technique, and understanding their own bodies from a patient perspective. So we're gonna go inside the circle, and I want obviously to be a very interactive discussion. So I already have some of my circle members asking questions in my chat. So you have to go to drrobscircle.com, drrobscircle.com. It's free to join. We're gonna have a live Q&A in there. So hop off of Facebook, Instagram, TikTok, and YouTube, and go into drrobscircle.com. All right, let me see what I got. All right, Jen did join on Facebook. Thank you, Jen. Appreciate you. And Marianne Ortiz. Okay, we're gonna finish on Facebook. All right, and we're gonna finish on YouTube.